went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma.
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how may I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toes, head, chest, abdomen.
A place where love, life and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
Can I get a porter to recess, thank you? Porter to recess for a ward transfer, thank you. Can I bring up porter to recess, thank you?
Hello, King's A&E. Right, let's keep going. All we need to do is get to theatre. That's what we need to do.
How much acid does she have?
It's in orange.
Bad, yeah. Really bad. Did you see it? There was a big hole in my hand, mate. I know, the thing is, though, right, Jamie, I'm not just saying this, mate, but I've got a sixth sense. As soon as I walked in that job, so for some reason, as soon as I got in that van, I started feeling really weird. No, I don't want to be there. I'm not going back there. I'm never going back there. Never, ever going back there. For what the job was worth, it really weren't worth doing. You know what I mean? Anyway, well, it was. The job was worth 700 quid, but what I'm saying is, it was a bit more involved than what I thought. I mean, that was a lot of lino having to come up.
Housekeeper to recess, thank you.
Top to toe?
I want top
Everything.
to toe, so head, chest, abdomen, pelvis, and a CT angio.
Today, King's A&E will treat 406 patients.
Oh, gosh. We've had 5 new patients in the last half an hour.
Leading the trauma team is consultant Liz.
As an individual, when you look at an emergency department that is cram-packed full, hot, busy, noisy, it's overwhelming.
Pedestrian versus van, she's got upper and lower limb injuries. She said, I do not want any blood. So there's no point getting the blood because she doesn't want it.
It's almost, I guess, like an overview of a battle scene.
Oh, hello, this way, sir.
But we do have to slow down at times. Because quite often it's the quieter patient that's the most serious one. Those sort of things require a real degree of loving care and patience, and it's then that I truly value my nursing staff.
I'm
just going to pull the curtain for a second, just swap. My name's Anna, by the way. I'm one of the nurses.
My name's Clement.
Hello, Clement. Nice to meet you.
85-year-old Peggy has been brought in by ambulance after a fall at home.
Hello. My name's Anna. I'm one of the nurses. Hello. What's your name?
I'm called Peggy.
Peggy. Hello, Peggy.
It's her second serious fall in 2 months.
My name's Muriel.
OK.
I just found out 5 minutes ago.
But she likes to be called Peggy. Fine. And is that your husband, Clement, out there?
Yes.
When we have elderly patients who come in, probably not used to the pace of A&E, it might be scary atmosphere for them with the noise, the people, the movement. So I think that's when I try to make them feel a little bit safer.
No way, darling. You stay nice and relaxed for me, OK? Well done.
Oh, sorry. And I'm just going to pull you...
I'm going to slide you across.
Just keep your arms across your chest there. Well done.
OK, ready? Ready, steady, slide. Oh, there we go. Lovely. That's all right. Where does it hurt?
Everywhere.
Everywhere. It's sometimes exactly what you need, rather than everyone around them and lots of things happening. You need to slow it down, maybe just have you and them, try and make a bit of a connection with them.
Peggy comes from home,
Yeah.
with hubby, has carers 3 times a day.
OK.
Dementia, Alzheimer's.
Right.
Hypertension was released from here on the 19th of March after having a similar episode where she collapsed.
OK.
She fractured her left hip. Witnessed by the husband again today, using the Zimmer frame, got to the bathroom door. Same thing.
Same
collapsed. Found her in the hallway. She's complaining of right knee pain.
Sorry. Oh, swollen knee.
OK. So then we did the ECG. OK, with 12 lead, which shows left bundle branch.
Peggy was very self-sufficient until she fell and broke her leg. She's still used to the cooking, the laundry, all these things. Obviously, I was concerned, but not unduly worried because, OK, you know, in 6 weeks she'd be OK again.
Peggy,
Yes.
the doctor will come and have a chat with you, and you'll probably go for an X-ray, or they'll do an X-ray of your knee here. So we need to see what's happening with your knee.
All right.
Thanks ever so much. Thank you.
When she came home, she didn't seem to enjoy any food and drink. It wasn't like her. About 5 days later, she fell over again, so they took her straight away down to King's. Oh, my sweetie.
What?
You must get better. You must get better and come back to me. You must concentrate on getting better and coming back to me.
Right.
Yeah, exactly, and she's just gone over a trolley.
It's all right, sir, it's fine. You're OK.
Shouldn't feel this. Oh, OK, you did.
A little bit, yeah.
Could Dr. Matthew Edwards please contact minors?
I can't, because I'm in here.
I thought that was you.
Yeah. Right then?
Do you enjoy your job then?
Yeah, I do.
That's good, isn't it?
I like it. It's, sometimes it's quite difficult.
Agree with that.
OK. So you see there, that's held it together. You can't actually see where the cut is.
That's really good, really neat. It's actually, you've done a good job of that. I was a bit worried when I come here. I'll come in a minute and get that. Thank you very much.
On your way.
Cheers, Matthew. Thank you.
OK, bye.
It's filling up. Does that mean that I'm going to get bumped and bumped and bumped because all I've got is a fucking finger?
What alliteration.
Fat fucking finger.
What?
Fat fucking finger.
Festering.
Fragile.
Can't think of more.
It's your turn.
I'm trying to think.
Your shit.
I thought of festering. Festering's
You're
probably the
supposed to be
best
a
one in
thespian.
there.
You can't even think of 4 words beginning with F to describe my finger.
We'll look at it.
So I'm just going to wire you up.
Darling, the ambulance man gave me this as a memento.
Oh, is that a souvenir?
As a souvenir.
85-year-old Peggy is waiting for her knee to be examined. Medics also want to find out if there's a more serious reason behind her fall.
Is my husband still here?
So how long have you two been married for?
58 years.
58 years.
Yes.
Marvellous.
For better or for worse.
Absolutely.
And we're still waiting for the better.
And how did you meet?
At a friend's 21st birthday party.
Okay.
Yes.
Those days sound so romantic.
Well, it was quite romantic because it was a dinner jacket affair.
Okay.
But I'd grown out of my dinner jacket, so I had to wear white tie and tails.
Oh, really? Just like the youth of today do when they go out courting.
Well, that made her think. The girl who was throwing the party said, "Oh, Peggy, there's a chap here I'd like you to meet." And I just knew. I don't know what it was about her. I just fell for her straight away.
And can you remember what Peggy was wearing?
Well, she was wearing a black dress, I know that.
Okay.
Looking very glamorous.
Hand-me-down.
A hand-me-down, was it? Well, it did the job.
Yes, I always wear hand-me-down.
The only problem was that I'd gone to the party in a pre-war Austin 7 with a very dodgy battery. And in those days, you had to have parking lights on the car. And I knew the battery would be flat if I put any parking lights on. So I parked in the lights of a large, gleaming Humber. And it turned out that Peggy's current boyfriend was the owner of the Humber. So how does an impecunious, hopeful engineer with a dodgy Austin 7 prize his girlfriend away from him? Not easy. Anyway, we hit it off.
When are you going to have some time off?
When am I having some time off? No, don't worry, I have plenty fun when I have time off. I work hard here and then I have a lot of fun. That's the
I'm
way.
very glad to hear it. Lots of boyfriends?
Loads. No. No.
Just one special one?
Maybe.
I'll sit down just here.
Can you remember how you proposed to Peggy?
Yes, it was something of an accident. My mother's parents were staying with my parents. They all knew her. And the conversation somehow got round to rings. My mother's engagement ring originally belonged to my father's mother. It was one of a set of 4. It was a set of diamonds, rubies, emeralds and sapphires. So I said to Peggy, "Well, what sort of ring do you like?" And Mother leapt to her feet and said, "Oh, Clement, I'm so glad." And my father said, "I'll open the last bottle of 1927 port." And I thought, what are they talking about? You see, have they gone raving mad? And of course, then the penny dropped. And I saw Peggy smiling away and I said, "Ah, ha, ha, no. Yes, that's it." And somehow that is how we got engaged.
All right, let's get a doctor to come and say hello to you.
One man.
Go on, sorry.
I don't know what I was going to say.
One man, two...
Probably one man, two governors.
Yeah, but about
I don't know what I was going to say. But it was good.
25-year-old Ben has come to King's with a swollen finger. He's here with his younger brother James, who's come down to London for a drama school audition.
No, me and James are chalk and cheese, really. We get on brilliantly, but we are quite different. I'm into sport, and he's not. He's quite forthcoming, quite theatrical, and I'm certainly not that. All right.
I realised I did that.
Staring over my shoulder.
Who do you reckon's the funniest out of you and Ben?
Well, I don't like to blow my own trumpet, but no, I'll go with me. He doesn't like to be late or doesn't like to leave things to last minute. I think that's the opposite to me, so we're a good balance.
He's a lazy pain in the ass. He doesn't really do what he needs to do sometimes. He needs a kick up the backside to get him moving, but he's 19. He's going to be like that, isn't he?
Good addition to my stay here.
What, visiting King's College Hospital A&E department? Because your brother's got a gammy finger.
Shows. A&E.
Hospital.
Brilliant.
I'd come down to London on the day to audition for my course and then spending time with Ben. And then we decided we'd go watch a show in the evening. So we went to see One Man, Two Guvnors.
I couldn't really clap in the show, and when I got out, my hand had swollen past my wrist. So the only thing I could do was go to A&E. Felt a bit stupid, to be fair. I had a cut and a bit of a swollen finger.
So am I coming with you to see the doctor?
You're going to have to. You're my next of kin.
Yes.
Apparently.
Yeah.
So in the eyes of the hospital, do I have no parents then? Because I've had to put my brother up.
Probably. Oh.
Orphan.
Adult phone in 12 minutes, that's adult phone in 12 minutes.
So brilliant. Brilliant, brilliant, brilliant. Beautiful. And it was someone getting drug box. Yeah, why don't you put out a fast bleep for the anaesthetist to resus? They're here. No, that's not him.
Doctors are preparing to receive 2 patients, both with suspected heart attacks.
Has he got a pulse with it?
75-year-old Bob has a history of heart disease and has already had a triple bypass. Doctors are concerned his heart could stop at any time.
Can I have 2 A&E doctors to resus, please?
So basically, we're going to give you something just in case you had a heart attack. So if one of your blood vessels or your grafts got blocked,
yes.
So we'll give you some aspirin, some clopidogrel. For now, there's a risk to your heart.
Yeah,
so we need to give
fine.
you all this, okay? And in the meantime, we're waiting for the blood tests.
Yes.
To find out whether you had a heart attack or not.
Okay.
Right, as a cardiology doctor should be coming shortly.
Thanks. Hello, mate. I'm all right. What I've got is tachycardia. The heart is beating irregularly, and they want to make sure it doesn't stop beating. So here I am, just lying here, staring into the cubicle, really. I'm dying for a pee, actually.
How are you doing?
All right. Well, I've been very well looked after, Matt, honestly. No, I'm not going to. The nurses have insisted that I don't die. Right. Well, OK.
I was about 19 when I met my first partner. We had 3 children. Life went on. When I met my second partner, I was 50. I have 1 son, Matthew, and a stepdaughter, Olivia.
I promise, all right? See you in a minute, all right. Bye. Love you too. Bye.
Oh, is that your son?
Yeah.
Is he worrying?
He's gonna fucking die on me.
Did you say?
But he's only 25.
Really?
He's only a young boy.
Oh, so you had
My
him quite
youngest
late
son.
in life?
Yes, I was 50.
It was very interesting at that age to start a new family. Thoroughly enjoyable to once again be able to push a pushchair around the park and do things with a young child that you hadn't done for a long number of years. But as time went on, you realise that you haven't got the same physical strength that younger parents have got. And so, like, playing 1.5 hours of football in the park was a bit past me.
Yeah. What about food?
Well, I can get you a sandwich. Meat, cheese, egg, What do you prefer?
Egg's nice.
Egg? Yeah?
Lovely, thank you.
Okay.
Do I need to give you some money for it?
No.
Don't, oh.
It's the NHS.
Out of every patient that might be quite challenging or situation that might be challenging, there'll always be a situation or a family or a patient that'll remind you why you're doing the job and will sort of break through everything and just be this sort of little shining light that just keeps you focused on why you do what you do.
Hiya.
Hello.
I'm one of the A&E doctors. What I need to do is I'm going to bring this down a bit and I'm going to just examine you, OK?
Okay. Are you from India?
No, from Birmingham.
From where?
Birmingham.
Yes.
My mum's from Kenya and my dad's from India.
No,
I just
she
know
was
India.
born in Darjeeling, that's why she asked.
The good tea.
Very
That's
good.
where the tea comes from.
I prefer Earl Grey myself.
What?
I prefer Earl Grey. Or Assam. Your temperature's quite high, so I think you've probably got a little bit of an infection going on. And maybe that's the reason why you had a bit of a fall. Have you got any children?
Yes, I've got a daughter and a son. My daughter lives in Chelsea and my son lives in America.
I hope I'm not hurting you.
No. You girls are very good.
I'm glad you didn't call me a lady, because I can't be called one of those.
Well, you are a lady.
I don't feel like a lady.
You don't feel like a lady?
I don't feel like a lady.
She has a lovely personality. She's always been very artistic. She's done sketches, mostly portraits. She prefers doing portraits of people rather than landscapes or anything like that. I'm afraid I'm not artistic, purely and simply an engineer. You know, it's rather unexciting.
What you're going to get is a chest X-ray. We'll probably need to get another urine off you, and most likely you'll need to stay in. But I need to examine you as well. But let me just send these bloods off first, okay? And then I'll be back.
What happened?
I don't know. You just suddenly let go of the Zimmer frame and fell over. I don't know why.
I don't know why.
Well, her memory, unfortunately, has been affected by her Alzheimer's.
What was it I didn't want to do?
What?
What was it that I didn't want to do and you said, no, you've got to do it?
You didn't want to go for a whittle.
And that's when I fell over.
You were almost there when you fell over. Her memory is erratic. She will ask me what day it is, and I'll say, oh, it's Tuesday, you see, and then half an hour later she'll say again, what day is it? And she might ask the same question 4 or 5 times. On the other hand, more distant memory is rather more reliable, you see.
There's no need for you to stay now.
Well,
you know where I am. When I was at schools in Shillong, we had earthquake drill rather than fire drill.
I know it is a progressive illness that can be slowed down but cannot be cured.
You better go home, darling.
Well, I'll stay a little bit longer. She doesn't forget who I am. Well, we've known each other for 59 years now, so I think I'll take a bit of forgetting.
Could we hope Porter to read us to take a patient around with your CT?
Is it neurosurgery that she's under?
So his VBG's here.
Quarter to recess for a ward transfer, thank you.
How is everybody then? Chilling? Chilling?
Happy and laughing.
Ben?
Ben. I'm calling we, aren't I?
Okay.
Hello.
Please come through. My name is Dr. Kuzmin. I'm one of the doctors here. Please come through. Right, what can I do for you, sir?
Well, I have a cut or something on my finger, and now it's pretty badly infected. Don't know whether it's a cut, a bite, an ingrowing hair that's got infected, but today it's just got really swollen.
Is it hurting?
It's hurting, but it's hurting because it's swollen, I think. I can't really move it, my fingers too much.
Are you allergic to anything, sir?
Nothing medical, no.
You're not allergic to penicillins?
No.
No. Do you take any regular medications?
No.
No. You're asthmatic?
No.
Diabetic?
No.
Epilepsy?
No.
History of jaundice?
No.
Nothing like that?
Nothing.
Your family history, remarkable for anything? No? Mom, dad?
No.
No.
No, pretty standard, really.
Good. So, one of the way of dealing with this would be to refer you to plastic surgeons, okay? And obviously starting you on antibiotics, because what you've got at the moment, it looks like cellulitis, okay? Which is the inflammation to the next layer under your skin, okay? Because it is your hand, and it can cause contracture, meaning that you won't be able to flex your fingers, and that's already happening away, okay? This is more serious, and it requires more people to get involved.
Right, okay.
Okay?
Yeah.
Good. Give me a sec. All right.
Well, I'm glad we came.
Plastic surgeon.
They're gonna whip me finger off. Oh, God. It's all funny, this, isn't it? Until they go, yeah, actually, your finger's dead.
Yeah.
Sozza. I wonder how that's happened, though, so quickly.
No, I can't put a finger on it.
Hey.
Was this? I delegated that because I felt there were 3 doctors in there, but I've given it.
Adult blue light, 4 minutes. Adult blue light, 4 minutes.
I've got a free-range egg and salad.
Oh, that's wonderful. That's great. Thank you very much.
75-year-old Bob has a history of heart problems. The medical team are trying to regulate his heartbeat to reduce the risk of a cardiac arrest.
Hi, Liv. She said it might be a silent heart attack, but they want to keep me in tonight because they said it's quite dangerous. You know, your heart could suddenly stop.
Hi there.
Oh, he's here now, is Matt, now?
You okay?
Okay, bye. This is Matthew.
You're right there.
Come on here for a minute. That's great,
Yeah, but I've got...
That's great. Look at that. Hardly been read. Yeah, they're going to keep me in overnight.
Yeah.
So they keep this machine going, because if they think I'm about to die...
What's the prognosis?
He's receiving a medication that keeps his heart in this normal rhythm. So as soon as there's a bed available, he'll go to a nicer, more comfortable...
Can you come with me?
He's a charmer, isn't he?
Oh, yes.
My relationship with my dad is very good. It's very close. I still live with him now.
Well, do you want me to take some of this stuff off? You look
No,
like
keep
you've
it
got a
here,
whole
because
load
it's
of
the
stuff.
hand.
So should I put it in your bag? Because they'll bring it up anyway. Because otherwise you just got loads of stuff lying all over you.
OK.
It's usually him telling me that I need to do stuff and me not doing what I'm supposed to, but we get there in the end.
Seem to be enjoying your sandwich.
But obviously I did the right thing going to the doctor.
Yeah, of course you did, completely. I've been worried about you.
You're in good hands. I've always been well looked after here.
Yeah, but of course, Dad, I'm going to worry about you, aren't you? You're my dad.
Of course you are.
Why is your thing beeping?
Somebody will come. You can't tell if it's a lead coming off or what.
What's the yellow one?
The yellow one, I forget what that is. The blue one is the amount of oxygen in your blood, in percent. And the top one is your pulse, 78, 77.
Is that good?
Yeah, it's normal.
When you go to school, everyone else's parents are in their 40s or maybe in their 50s. But when your dad is in his 60s, you often have comments from people, oh, is that your granddad? Oh, your granddad's picking you up, or your dad's old enough to be your granddad. And I think from quite a young age, I was very, very nervous about my parents passing away. So I think, in a sense, I've kind of prepared myself.
Sorry, I don't mean to be worrying you. I think I'm worrying more than you are.
I've been told about this sleeping thing. Don't worry about it.
No, okay.
Is it all right, yeah?
It's worrying him more than it's worrying me.
Don't worry, it's just it's finished. That's why it's sleeping. So
Oh, right.
Someone is going to come to sort
Thank you very much, thank you. Top man.
He was very efficient, wasn't he? He came in, snip, snap.
It was hard, but it's been very good having older parents because they have much more life experience. So there's a lot more that they can teach you from a young age.
I love you, Dad.
Love you too, Sparrow.
You're a good guy, you know.
Well, I keep trying.
You don't have to try, you're already there. Just wish I was more like you, that's all.
If anybody knows where the weighing scales are, can they call Majors 2410? Thanks.
Just misplaced them.
She can't find a bucket. She can't find a weighing scales.
Isn't it?
Oh, hello. I need to speak to plastic surgeon's registrar.
The doctor is consulting with specialists about Ben's infected finger.
It's quite aggressive. And he needs a plastic surgeon.
Severely.
To decide whether he's got to whip my finger off. What?
Take a bit of flesh from, like, your inner thigh.
What, and turn it into a finger?
It's just like a stick of meat.
Just a floppy stick of meat. I play cricket. I think I'd be all right with that one missing. But, yeah, I wouldn't want to have 3 fingers, definitely not.
And this ring finger is flexed. He can't extend it fully now because of the pain.
I'm supposed to be going out on Thursday night.
But you're not doing that.
I'm not going to do that when I've just had my finger amputated.
Antibiotics as well.
Oh, I'm still going
Can
out.
Porter bring a trolley to Majors
Trolley?
447, please?
Bucket. Weighing scales.
Weighing scales.
So he came back. Oh, he's there. He's just researching amputation.
They accept the patient. It's very serious. It's very serious, usually. So they want X-rays, they want bloods, they want 1 gram of augmentin, and then send it to them.
Just word serious 3 times. It's serious. It's very serious. His hand is very serious.
Don't say things like that, because I'll have to get chisel out. I was shocked because I didn't think I'd have any problems. We were still thinking it was going to be something, nothing, here, have some tablets. Off you go. And we overheard someone say severe and extreme, and we knew he was talking in relation to us, so we were both sat there thinking, oh, maybe there is something wrong.
Can I please have a Porter to resource? Porter to resource, thank you.
Yeah, that's what sounds like theme hospital when they make those announcements.
Ding, ding.
Yeah, it goes ding, ding.
Could the nurse in Ward 3 please clean up the dead body? And
Yeah, that's right.
Bob is being monitored as doctors think he could still be at risk of a cardiac arrest.
Oh, God.
You okay?
That's better. Did you leave is my watch kicking around somewhere? Or?
Where would you have put it?
No. It might be in there somewhere. It's not under that private eye, is it?
My dad's a very easygoing kind of guy. He doesn't let things get to him.
Oh, there it is.
Where is it?
I think that's it. Yeah.
Just...
Mum bought that for you.
Eh?
Mum bought that for you.
Yeah, I know.
I remember going with her and choosing it in Marks and Spencer's.
Yeah, it's a very good watch. I had new batteries put in.
My mum, sadly, she's passed now. She died 2 years ago. But she was an amazing woman. No, I've never met anyone like her. I don't think I ever will. My dad loved my mum beyond words. And yeah, when she died, it was a massive loss for him. At first, we didn't actually, my mum didn't know that she had cancer, and she started to have pains in her leg, and she always thought it was sciatica. But the pain just got worse and worse, and stretching wouldn't do anything. And when we went to the hospital, they took a long time to get the test results back, and she came back and she said, I've got some news and it's not very good, and she told us she had cancer. And I remember saying to her, but you're going to be all right, aren't you? And she just looked at me and she just shook her head. And I said, what do you mean you're not going to be all right? She said, but they gave me 6 months. I just can't describe that feeling. It was surreal, really. Because you know that it's real, but part of you doesn't want to accept it. But it was difficult because the cancer kind of, you could see it slowly just taking its toll. You could see her trying to fight against it, but it just wasn't working. It was very, very difficult to see someone that you love have slowly kind of, in a sense, fade away.
Yes. But I'm worried about her because she's not doing any exercise, and you know, the muscles very quickly waste away
do get weak.
Don't.
Peggy's been given antibiotics and painkillers. She's waiting for an X-ray to see if her knee is broken.
You look very tired, Peggy. You look fed up, as you say.
She sleeps most of the time.
Right. Okay.
I am fed up with life.
She gave me 2 wonderful children, 1 boy, 1 girl. My work sent me on a couple of tours to India when they were both very young, and Peggy coped with them wonderfully while I was away. She just coped with everything. Yes, she's in a very depressed mood.
When your mobility and everything changes and what you normally do changes, I can understand why.
Normally, she always makes an effort at things, but she doesn't want to do anything except lie in bed and sleep.
Yeah.
I don't know how to motivate her. I wish I did. Oh, I hate it. I hate it. It's most unpleasant, seeing her going downhill. I don't want to lose you. What? I don't want to lose you. You're my sweetie.
In through my nose and out through my mouth. Helps the pain.
Good.
To breathe in through your nose and out through your mouth.
I simply have to face up to the fact that she is going to deteriorate. And all I can do is hold hands. I know it sounds ridiculous, but somehow it's very comforting. A kiss always helps.
What?
A kiss always helps.
Clean.
Well, that's ridiculous. I honestly thought that it would be straightforward.
And I've got to go and see a plastic surgeon tomorrow morning.
Yeah.
I've just got to go to a hospital and say, hi, I need a plastic surgeon.
Oh.
Are you tired? You getting
I'm
tired?
getting a bit tired, yes.
Go home, darling.
Huh?
You can go home if you want to. Basically, I think Peggy might be staying in.
Yes.
Under the medical team, potentially.
Right. People are often thrown into the role of a carer without knowing if they are capable of doing it, and it's amazing how people do take on that role with such genuine feeling.
Nothing much is going to happen now, is it?
Nothing much, no.
No, it's all happened.
Yeah.
That person wasn't always like that. The life before, there's a life within, and you have to maintain that dignity for them.
I'm going to take you to X-ray, Peggy.
Yes.
So if you want to go home now, because I'm going to take Peggy to X-ray.
Then I can say bye-bye, my sweetie, and see you tomorrow.
All right, Nalaki, Nalaki.
Nalaki, Nalaki.
That's Tamil.
Tamil.
Is it?
Yes.
Means
Is that
tomorrow.
your little... Oh.
She knows a few words, mostly Hindi she speaks.
Right.
I speak Hindi. Borchikani Hindustani.
Tikai. Tikai.
Tikai.
Lovely to meet you.
Yes, and you, yes.
Okay.
And thank you for all you're doing for her.
It's a pleasure.
Marvellous.
Safe, safe journey home.
Thank you.
Yeah.
You don't have to hang around, mate. I'm tired.
Oh, I want to wait for you to move, Dad.
Bob's waiting to be taken to the specialist cardiac unit for further tests.
I said I don't really want to go and leave you because it's a bit lonely here.
Lonely?
Yeah, if there's no one sitting with you, then you just sat here by yourself.
I'm very happy in my own skin, you know.
I know you are, but...
I've got my private eye. Read that.
In a lot of ways, Matthew was very much like me, but there's an undercurrent which is very strong, which is like his mum.
Oh, Dad, I think I might shoot. I'm not running away, it's just I'm tired, I'm going to...
Yeah, go on, man. You go.
I think he's very conscious of my age, and it is something he should think about. None of us are immortal. Parents are not there forever. There's no escape from it.
How are you feeling?
All right, I just want to lie down and go to sleep.
I do think about what would happen to him when I go, and it's not really a mission, but I'd feel very happy if I could get him to be really independent and on his feet, and conscious of the fact that, you know, I won't be kicking around forever, and feel that he could cope with that and not fall apart.
Listen, please ring me. It doesn't matter how small it is.
Yeah, I will.
If you just want some company or you
Yeah,
just want someone to come and see you, ring me. I'll keep my phone by my bed.
Honestly, I promise.
I'm sorry, I know you hate fusses.
See you later. Go on, have a good night's sleep. Enjoy that cottage pie.
Remember what I said on the phone?
What's that?
Don't bloody die.
No, I know. I'll send that to the nurse.
I love you too much for you to die. You're not allowed. Positive, you're all right.
I'm fine now. Look at me. What I'm dying for is a wee.
Have a good one.
Okay, bye. I'm fine, mate. Go on, bugger off. Go on.
See you later.
See you later, man.
Be good, all right?
Yeah, I'll ring you when they've moved me. Yeah, 11:30. Go on. See you later. See you later.
You know what I'm going to do?
What are you going to do? Take a picture of it? Oh, yes.
It was 2 operations. I think the original cut that got infected was a couple of millimetres, but they cut me open 2.5 inches from the middle of my finger up the top past my knuckles.
Instagram, hashtag cut it off.
Got a bit of a scar. Trying to think of a decent story. Maybe saving a child in front of a truck or something, but yeah, infection's a bit lame really, isn't it?
Should I get an attack of arrhythmia and worse still, a cardiac arrest, it gives you a shock of 800 volts across the heart. Fortunately, so far, it hasn't kicked off. I know that because the surgeon said, if it does kick off, you'll know. It's like being kicked in the chest by a horse.
He's a fighter, definitely. I look after him and he looks after me. We've been through so much. So yeah, I think when we move, it will be like a new start for us. And I think Mum would be very proud.
you.